Ruth in Dallas writes, Dear Dr. Travis, I'm currently on several medications that have been prescribed for me by different doctors. One is for my allergies, another is for arthritis, and the third is for pain. Is this okay, or could it be a problem? Well, if you're taking multiple medications and they're all prescribed by different physicians, it certainly could pose a risk to your health if you don't take them properly. So here to explain the benefits of having all your prescription medications in one location is CVS pharmacist Yushima Thomas. Welcome to the show.
Thanks, Travis.
Good to have you.
Good to be back. And you're right. You know, when you're taking more than one medication that are prescribed by different physicians, you are at a greater risk of having drug interactions because these doctors may not know that each one is prescribing something. But when a customer brings me all their prescriptions, I'm at a better position to prevent this from happening. Now, your pharmacist serves as a very important link among all the members of your healthcare team because it could be that you have a drug that's causing another drug to be ineffective, or it's causing you to have a potentially dangerous and harmful side effect.
And a lot of times people don't realize that over-the-counter medicines can have adverse effects, and so you can address those as well. Because let's say you're taking an over-the-counter antihistamine that makes you feel really drowsy. We all know this if you've ever taken one. Really sleepy, but you're also being prescribed another medicine that is sedating. If you take those two together, it can cause some serious consequences. You certainly shouldn't be operating machinery, driving a car, so you can help with that kind of thing.
Right, and when you have all of your prescription records at one pharmacy, we can advise you of that risk. You know, it's really important to talk to the pharmacist, not only about your prescription medication, but about the over-the-counter medication as well. It's important to keep us abreast on your medical records so that we can advise you properly on what to and not to take that's over-the-counter.
Okay, we have another question from a viewer, George from Los Angeles, who writes, Dear Dr. Travis, I have high blood pressure, and although I have insurance, I'm concerned about the high cost of my medications. So sometimes I don't refill all of them. Is that dangerous? Well, we brought George here with us today to discuss this issue. George, thanks for coming. And I'm going to tell you right now, George, it can be very serious. And the number one reason is that high blood pressure, you may not have any symptoms. And you stop taking your blood pressure medicines, a lot of bad things can happen. I'm going to show you on our magic wall, okay? Blood pressure, you can't always feel high blood pressure, but assuming you're doing all the right lifestyle things, but you still need to be on medication, your blood pressure medicines keep your blood pressure in check. If you stop taking those medicines, your blood pressure is going to go up. Over time, that can lead to kidney failure. We've talked on the show before, high blood pressure is a leading cause of heart disease. This high blood pressure can not only increase heart attacks, but strokes. And there's even something called hypertensive retinopathy. Uncontrolled high blood pressure could lead to blindness. So these things, when they're all added up, I would take my blood pressure medicine because if you need to be off your blood pressure medicine, the only person who should be making that decision is your physician, and that should be communicated with your pharmacist.
And George, a heart attack or a stroke is going to cost you a substantial amount of money in the future than you just picking up that refill. You know, Travis, 1 in 3 people who are prescribed a new prescription actually stop taking it before that next refill is due. And it's because of George's issue, because of the medication being too expensive for them to take. And if this happens, you know, talk to us. Talk to your pharmacist. Let them know that this medication is too expensive. I'm probably not going to get this refilled. We'll be more than happy to reach out to your doctor to see if there's a less expensive generic alternative that your doctor may think that it's more suitable for you. We're actually here to help you understand how your insurance works, whether it's your regular insurance or your Medicare plans, to make sure that you're going to save money on all of your prescriptions.
All right, George, are you done skipping your
Is that
blood
okay,
pressure
George?
medicines?
Did I answer your question?
You most certainly did.
All
and I really
right,
appreciate that life-saving information.
Great,
Thanks for
great.
coming on, George. And I do want to highlight another mistake that people make, and that is not taking their medications properly. And it can be so confusing, particularly if you're on a lot of different medicines. But if you don't take them properly, it can certainly lead to a worsening of your condition or your illness.
And unfortunately, Dr. Travis, 50% of people do not take their prescriptions as directed by their doctor. They're not taking their doses correctly, which is why it's very important for us as pharmacists to educate the patients on how to take your prescription. Make sure you're taking it as directed by your doctor, to make sure you understand how important it is not to miss those doses, to take it the same time every day.